This is the last Humana meeting. We had one earlier this morning. So all of these meetings that we have had today are in an effort to make sure that you guys are aware of what the changes are coming up on the Blue Cross side to Meritan, and that you have options as a retiree with Medicare, okay? So first, I wanted to go over open enrollment. So open enrollment is going to be starting bright and early on Monday morning, September 22nd, I was about to say October. September 22nd, and it will end on October 24th. If you need to make changes to your health insurance, aka drop, change a plan if you don't have Medicare, or enroll in our Humana plan, you can do that during open enrollment. There is a deadline, October 24th. If you need to make a change to your health insurance, you need to do it within the confines of these dates, and it has to be sent directly to our office. We need to know, you need to connect with us to make a change. You need to make sure that we send you a confirmation that we have received your change. It's very important. So everything has to be turned in by close of business, which is 4:30 on October 24th. Throughout open enrollment, we're going to be sending out communications to you guys. We have a lot of information that we need to send your way. We are not going to send it through the fire hose. We are going to send it in bite-sized pieces. That way you receive the information, you can read it thoroughly, digest it, until we send it through to the, because it'll be likely weekly that we'll be sending communications. It's going to start at open enrollment, and it'll go all the way through till December before we start with the new plan come January 1st. Those communications will always come to your emails, so please make sure that your email address is updated with us. It's very important. That's how we're able to send the large amounts of information that we can. We will be sending mail. Mail is, we're limited to what we can put in the mail as far as the space and the amount of information we can send. And we'll also be sending it through as a text message. Usually what I tell people is when you get that text message, that lets you know, hey, LPSS insurance sent me an email that I need to go look at further, okay? Also wanted to let you guys know that we're gonna have a brief Q&A after this meeting. If you do not get your questions answered, obviously we don't have a whole lot of people in here, so I'm sure we'll be able to get to everybody's answers, plus it is the last meeting of the day. So just want to let you know that is what is after the meeting. So that's all I have, but now I'd like to welcome Ms. Elizabeth Stamper with Humana.
Thanks, Ashley. As you stated, my name is Elizabeth Stamper. I am an account executive with Humana. And today we're just going to go through all the information on the plan, the benefits, and everything that's available to you. Like she said, afterward we'll have a brief Q&A. With me today I have Kayla Tooley back here. If you guys have any questions, you can ask me, you can ask her, you can ask LPSS. So we're all here to answer your questions. Hold on one second. How about change the... Oh, there we go. Okay. So a little bit about Humana. Are we good?
Yeah, I'm just going to close out that blue box.
Okay.
Perfect. There we go.
Thank you. Okay. A little bit about Humana. We have been dedicated to communities around the country for more than 30 years. We have 8.7 million Medicare members, just like you, across all 50 states. That's a lot of members. Nationwide network of providers, so we'll talk about that a little further in the presentation, but we do have providers all over the country that accept our plans. In 2024, we were voted Best Overall Medicare Advantage Plan Company and Best Company for Member Experience. And then we have been providing Medicare plans to beneficiaries since 1987. So the next part we want to talk about is Medicare, especially if you're new to Medicare and understanding the parts of Medicare. So Medicare Part A is typically called hospital insurance. This is for inpatient services, inpatient hospital, inpatient skilled nursing, anytime you are inpatient in a facility. We get this question a lot, so I always mention it. When you worked and you saw Medicare come out of your paycheck, this is what you were paying for, this Part A inpatient service. Now, move to Part B, that is covering all of the other medical services that are not covered under Part A. The outpatient, doctor's offices, outpatient surgery, durable medical equipment. That's what Medicare Part B covers. This is also where your premium that you pay to Medicare goes. That $185 that you're paying, this is for Medicare Part B. That's what that is. We're going to skip C and go to D. Medicare Part D is your drug coverage. You can only get Medicare drug coverage through a carrier like Humana. Back to Part C, that's what the Humana plan is. Humana is a Medicare Advantage plan. So what Part C plans do is they take your Medicare A, B, and D, and then we administer that for Medicare and for you, and also add your additional benefit in there that you get from LPSS. That centralizes everything, and it also gives you the opportunity to have one card versus having multiple cards every time you walk in to a doctor's office or a pharmacy and have to determine which card you get. And I talked about Medicare Part C. This is a PPO plan, or a Preferred Provider Organization plan. It gives you a choice of in-network primary care physicians. There are no referrals required. Most preventative care is covered at 100%. Nationwide emergency coverage, you can, in any of the 50 states, U.S. territories, you are covered for an emergency. There's no question on that. And then another really important part about this plan is that the cost share is the same for in and out of network providers. What that means is if a provider does not have a contract with Humana, but they are a Medicare provider that will bill us, they are going to get the same pay as if they had a contract. So as long as they're willing to bill the plan, they do not have to have a contract with us. And it's the same pay for them and the same benefit for you. Copays. The plan does not have a deductible or a max out of pocket. This is for medical. Outpatient hospital visits, inpatient hospital visits, $0 copay, as well as primary care, specialist, durable medical equipment, emergency room, urgent care. Almost everything on the plan is covered at 100% for medical, so there's no copay for you. We'll talk about Medicare Part D, the prescription drug. So our prescription drug coverage is available on this plan, so it's with your medical. We do cover generic brand and specialty drugs. It says list of covered drugs may vary by plan. So I want to mention that Medicare has a master drug list, and this is all drugs that can be covered on any Medicare plan. Our plans cover at a minimum at least 95% of all covered drugs. The reason for that is there's a lot of drugs, but also we have we'll have multiple drugs in each category that cover different things. So we're going to have multiple drugs that treat heart disease, multiple drugs that treat diabetes. Whatever that condition may be, there's going to be a lot of options that are covered on the plan. Another thing is that this plan does provide access to mail order pharmacies. And as we see when we go to the pharmacy slide, there is a benefit to using the mail order pharmacy. So this plan for the Part D portion, the pharmacy, there is not a deductible. There is a max out of pocket of $2,100. That is a max out of your pocket for all drugs. So as you pay your copays and your co-insurance for your drugs, that is all calculated, and if you reach $2,100 having paid out of your pocket, then you're covered at 100% for the rest of the plan year for all drugs. It truly is a maximum out of your pocket. As you look at the copays, if you get medication at a retail pharmacy, so typically a local pharmacy, for the preferred generic, a 30-day supply is $10, preferred brand, 30-day supply is $30, non-preferred brand, $60, and then specialty, 10%. That is a 10% co-insurance, so it's 10% of the cost of the drug. Now moving over to mail order, you can get a 90-day supply, and for the tier 1, the generics, it's $20, tier 2, $60, tier 3, $120. So you're saving a copay by actually doing it. You're paying for a 60-day fill, but you're getting a 90-day fill. The other thing I want to mention here, it says not applicable in specialty for the 90-day. That's because a lot of specialty medications have a lot of special handling, like refrigeration and different things like that. So those are not dispensed in a 90-day supply. We do have a robust network of local pharmacies. So if you don't want to use the mail order, that's totally okay. We have a lot of pharmacies within our network that participate with Humana. If you want to use mail order, we have multiple options, but we also have Centerwell, that is Humana's owned pharmacy. If you choose to use Centerwell, you've got some benefits by doing that versus using a different company's mail order pharmacy. We have patient assistance programs. We provide clinical support, and then you have, our agents are trained in our plans. But what's really important here, and I always say this, is when we're administering both your medical and your pharmacy plan, we can find trends. Our pharmacists can see, you're having this service or this drug, and that helps them a little bit, it helps them treat you a little better. So it is nice that your pharmacist can see what your doctor is doing. Another important thing to point out is Part B is in boy versus Part D is in dog coverage. So Medicare defines some drugs and some items as a medical benefit versus a pharmacy benefit. So things that may traditionally be assumed to be a pharmacy benefit, there are some that are actually medical. So examples would be injectable IV drugs given in the provider's office, diabetic testing supplies, insulin pumps, insulin for the pumps, and continuous glucose monitors, as well as vaccines. There are some vaccines that are actually medical. If you go into a pharmacy, you may think that you just need to give if you had a separate card, this is all one card, but you may think you just need to give a pharmacy card, but in reality, it's actually a medical benefit. So examples are your flu shot, your pneumonia vaccine, those are actually medical. They're billed to the medical portion of your plan. Now over to the Part D, the drug plan, that covers diabetes medications. Almost all medications are covered on this portion of the plan. Insulin administered or used with syringes or pens, and other insulin administration devices. And then it also says vaccines. So not all vaccines are medical, some are pharmacy. A good example would be the shingles vaccine. That's actually a pharmacy benefit. And the reason it's important for us to point that out is sometimes it's a little confusing for the pharmacist to know which portion of the plan to bill. Everything they need to bill, whether it's medical or pharmacy, is on your card. And we know sometimes, again, it still gets confusing for them. So especially around like the flu shots, that's always a big one. That time of year, we reach out to the pharmacies and we educate them. We remind them, hey, just as a reminder, on all of our Medicare plans, the flu shot, the pneumonia shot, that is a medical benefit. Make sure you're billing it correctly, because we don't want them to run your insurance and then say that your flu shot's not covered when in reality it is. They're just incorrectly processing the claim. Another important thing that we encourage you to do is to schedule your annual wellness visit. We want to make sure you're using all of the benefits that are available to you. So we have the annual wellness visit that's available to you. It's no cost. And a nice thing that as well is you can actually earn $25 in rewards on our wellness program, Go 365, just for going to the visit. So you're going to get rewarded just for going to that visit. Your annual wellness visit is a good way to get a personalized plan for managing your health. It's not your normal checkup. It's really the more relaxed conversation between you and your doctor, and to get more time with your doctor versus the 10-15 minutes we get to see them now because they're so busy. You can also schedule preventative physical examination each calendar year, and that would include the head-to-toe checkup, medical history, routine tests, screenings. But we want to point out that that is something that's available to you. Preventative care screenings, the plan covers a lot of preventative care screenings at 100%. These are some of the examples that we've listed here. Your flu vaccine, bone mineral density test, physical exam, colonoscopy, blood sugar reading. Those are all things that are covered on the plan. So don't hesitate to use those benefits. Again, these benefits are available to you, use them. You know, I know sometimes we just go to the doctor when we're sick, but it is important for us to make sure that we're getting those screenings and those checkups so that we stay in good health. MyHumana, so this is our secure online portal to help manage your plan. You can get personalized health information on MyHumana. You can access your coverage, your benefits. You can look up the price of drugs. You can compare the price of drugs. You can look and see what doctors are in our network. Again, you don't have to use a network doctor, but you can look and see which ones are. It does give you access to maps, so you can actually see how far away the doctors are, as well as another really handy tool. If you're using it on your phone, we have a MyHumana app. You can get an image of your ID card. So if you ever were to lose or misplace it until you get your replacement card, you could actually go in the doctor's office and show them an image of your card through the app on your phone. Smart summary, so instead of sending you an explanation of benefits every single time you have a claim and explaining how the claim processed, we actually send what we call a smart summary. So any month that you have had a medical or a pharmacy claim, we'll send you a smart summary. So if you filled a drug, saw a doctor, went to the hospital, we're going to send you a smart summary. If you don't fill a drug or go use your medical benefits, you didn't go to the doctor, you didn't go to the hospital in that month, you won't get one. But this was a way for us to kind of centralize all of that so you're not getting multiple pieces of mail and it's a little bit easier to read. We mentioned earlier on MyHumana, you can actually go in and look for any in-network provider. It's humana.com//find-care. That will show you any in-network provider. And I'll mention here too, because I got this question earlier, if you don't want to go online and look for doctors, call our customer service team. We'll do that for you. That is an option as well. So if you ever have questions about what doctors are in the network or what doctors may, will see you, give us a call. We'll take care of that. Another thing that's important to mention here is when the pandemic happened, we saw a huge shift to everything being online, including regular doctor's appointments. There was a lot of things done via telehealth where it was done virtually through your phone, through different apps. That benefit is still available. Just because the pandemic's over doesn't mean we stopped offering the benefit. We want to make sure if you can't make it to the doctor's office or you just don't want to go, you can have a virtual visit with your doctor, and that is covered on the plan. A couple other different services that we offer: clinical support, our in-home wellness assessments, education and resource support, care management for eligible members. So if you have multiple chronic illnesses or take multiple specialty medications, then you would become eligible for our care management programs. We see that via the claims that we receive, that you may be eligible for that. Then a nurse, a licensed nurse, would reach out to you and offer you that program. What the program is it's a way to essentially centralize your care. If you're seeing multiple doctors, you have multiple medications, sometimes they're not always necessarily talking to each other. And you want to make sure that you have someone that's looking at all of the different services that you're receiving to make sure everything that is working together, everything's working together. This is 100% voluntary. So if someone were to reach out to you and offer to participate, let you participate in the plan, and you decline it, that's totally okay. But that is one of the services that we offer. Another service that Humana offers is post-hospitalization support. So post-discharge personal home care. So this is up to 8 hours of support with clinical care. What that means is when you are discharged from the hospital, you can get home health. Home health covers anything that is needed as a direct result of your medical condition. Those medical services, so like physical therapy, if you need IV medications, coming in and changing those IV medications, those types of things. What you don't get as part of that service is you don't get help with readjusting to being back in your home after you've been inpatient. So readjusting to getting dressed, feeding yourself, those types of things. That's what this service is for. It's to provide support with those, we call them active daily living activities. So that's what that service is for. Another one is post-discharge transportation. So it's 12 trips, one way, up to 50 miles per trip. So what this covers is once you're released from the hospital and you have follow-up appointments, this is going to cover transportation to and from those appointments if you want to take advantage of that. I always say, it's really important. They're not going to take you to the grocery store, but they will take you to your doctor. And this question came up earlier too. When it says 12 one-way trips, what that means is it's to your doctor, from your doctor. So it's typically, if you're looking at a round trip, it would be 6 round trips. The last one for post-hospitalization support is post-discharge meal program. That's 2 prepackaged meals for 14 days for a total of 28 days, 28 meals. So if you are discharged from the hospital and you call our customer service team and you let us know, we can get you started in the meal program. We do ask that you go ahead and call us, because if we waited for the claim to come in, then you've already been discharged, you've moved on with your life. So, but yeah, if you give us a call, we can get you signed up for that. A couple other important items. I mentioned our wellness program, Go 365, earlier. So Go 365 is a wellness program that rewards you for doing wellness activities, and it says making healthier choices. But I always point out that stuff you're going to do anyway, like getting your flu shot, having your annual physical, getting a colonoscopy, those types of things, you can get rewarded for that, and it's automatic. As soon as we see those claims in, we give you those rewards. And then you can turn those rewards in for gift cards. You can do that on our MyHumana. And just to kind of throw out there, there's a bunch of different ones that you can pick from, but I've seen Lowe's, Home Depot, Starbucks. There's an online pet portal that you can go into. So there's a bunch of different options. And I always encourage everyone, go in and check it, because you may have rewards you didn't even know you had, because you've already done all these things and you've got rewards for that. Silver Sneakers is the fitness program. So that is the gym membership. And what that covers is the actual membership. So because you're a Humana member, you can use any one of our participating fitness facilities. And if you ever have questions, we can look those up for you too as well. And the Humana plan covers the monthly membership fee. So whatever you would pay to be a member of that gym, we would cover that. Any free classes, that's covered as part of that membership. If there's any additional classes that require any kind of additional fee that any member would pay, that would be charged to you. But that actual regular membership fee that you would be charged monthly, that is covered by the plan. And we have a lot of different facilities that are participating. Continuous glucose monitors, we want to talk about that as well, because those are covered under Humana Group Medicare Part B as a medical benefit. And you can get them from a participating retail pharmacy or durable medical equipment provider that accepts Medicare and will bill your insurance. So we just want to mention that is a covered benefit, because we get that question sometimes. Okay, enrollment. So as Ashley mentioned, open enrollment is September 22nd to October 24th. Per Medicare guidelines, you cannot enroll in a Medicare plan before October 3rd. So during that open enrollment period, prior to that open enrollment period, review your materials, be prepared on what decisions you want to make. That does shorten the time frame to enroll in the plan. Due to that, and after we mentioned earlier, it mentions there's two ways to enroll, but we are saying that we want you to call us. So if you're ready to enroll in the Humana plan, call us. Call Humana. Reach out to our customer service at the number listed here, the 866-396-8810, and call us. That allows us to do 2 things: answer any questions that you have, And it also allows us to make sure that we get your enrollment in and processed timely, because you do have a shorter amount of time to actually get enrolled. So I know it mentions the enrollment application that's going to be in the booklet, but we're going to go ahead and make this decision that we're 100% going to have you guys call Humana, and we will take care of the enrollment from there. After you're enrolled in the plan, you're going to receive an enrollment confirmation. So it's going to reach you in the mail and say that confirmation you're enrolled in the plan. You're going to get an ID card that's going to come in November, December timeframe. Then you're going to also get a postcard that says you can access our evidence of coverage. So instead of sending you the evidence of coverage, we're sending the postcard that tells you how to access it, which it'll tell you how to go online, or you can call us and we can have one mailed to you. This is the full benefit document. It goes into every benefit as detailed as possible. It is 300 pages long. You may not want to have it printed, and this is also the reason we don't send it to you. But yes, you always have access to that. And then we'll reach out to you about the health and well-being assessment. So that's the annual detailed health review, and it says it's conducted in your home. That's something that we offer to you. You are not required to participate in that. But I want to mention here that starting in 2026, those can be done through Telehealth as well. So if you want to have the health and well-being assessment, you can actually do that using an app on your phone. That is all I have for today. I know we have a short question and answer session, and that is all I have. Thank you guys for having me. I appreciate it. Thank you.
We're just going to do an informal Q&A. I'm thinking you probably have some questions that we'll either turn the mic back over to Humana, or perhaps Ashley can answer it because she's the subject matter expert, because she typically works with the retirees. Do we have any questions?
So if there's no changes made, you don't have to enroll, right?
Tell me which plan you're currently under. You're under Humana. Okay, so the question was, do I need to do anything essentially? No, if you're currently under the Humana plan, the LPSS group plan, it's just going to roll over to the new year. There's no change in premiums. You're just going to keep marching on like you typically do. Okay? That's a good piece. Let me pull it up and Ashley can...
I can rattle off the ones that I'm used to talking about. Usually people that enroll in Humana don't have like an entire family with dependents. But if you are a retiree of LPSS, your premium for Humana is $0. There's no cost to you, no cost share. If you are a couple and you are enrolling together and your spouse is not a retiree of LPSS, you will pay $0 and your spouse will pay $49. So it's $49 for the both of you. If you are both retirees of LPSS, you pay $0. And that's the premiums that we typically...
Actually discuss hybrid scenarios.
Okay, so Mistress was asking about the hybrid scenario. So last year we developed this process where if we had a couple and the couple was, let's say there was an age difference to 5 years, however long, the requirement to enroll in Humana is you have to have Medicare A and B. And there were couples that before we did the hybrid option, you had to stay together. Now we allow for the member that is Medicare eligible to enroll in Humana, either at the time that they become Medicare eligible or during open enrollment. What that essentially does is it allows, let's say the spouse turns 65 before the retiree. It allows the spouse to break away from they split contracts. The spouse with Medicare can enroll in Humana, and the retiree that does not have Medicare yet and not eligible for Humana can stay on, we're just going to say Blue Cross for now. Same scenario will happen when we move over to Meridian. This is a cost-effective option for members because you're not having to pay the higher cost for two people on the Blue Cross plan. Humana is obviously less expensive. So that's why we put that in place. We don't make people stay together anymore. There's obviously a tons of, not tons, but there are options for you if, cost obviously is an issue. Yep.
Y'all are a quiet group.
Like I'm talking to myself.
Okay, I just want to make a couple points, just so you're aware. So we're going to do ongoing communications with retirees. You're going to hear from us. You're probably going to get tired of hearing from us, right? Sir?
I have one question.
Okay.
12 trips to aftercare, is that per occurrence, per year?
Per occurrence.
Per occurrence.
Yeah.
So his question was, how many trips for?
The post-discharge support. So the question was, for the post-discharge support, there's the 12 one-way trips.
And he said, is that per year or per occurrence? It's gonna be per occurrence. So once you're discharged from the hospital and you've utilized that benefit, and then say, 2 months later you have to go back in the hospital, you can use the benefit again.
So just reminders, communications are going to come to you on an ongoing basis. Open enrollment, we're on the cusp of open enrollment. The first communication you're going to get from our office is this Friday, okay? If we have a cell phone or an email on file for you, you're going to get communications from us. It's going to tell you a lot with regard to the changes. If you don't want to make a change, can I get a show of hands? I'm thinking a majority of everybody in here is under the Blue Cross plan. No? Do I have some Medicare Humana members? Okay, so I do have some Humana members. Okay, so first off, if you choose not to do anything, you're just going to roll over to the next year. Everything's going to keep going as it should. If you're under Blue Cross, what's going to happen on 12/31, Blue Cross is going away. The board approved Meritain Aetna effective January 1st. So we're going to take care of the heavy lifting for that too. You're just going to transition. You're going to get your new cards. If you do absolutely nothing, we're just going to make sure that you get the materials that you need. You're going to get your card. You're going to update your pharmacy with that information. And then you're just going to use your card in 2026 and beyond with the new provider, Meritain Aetna. Okay? But be on the lookout for those communications, those open enrollment documents. It's going to be a bit at the beginning. We're going to give it to you in segments. Remember, Ashley said we're going to send a little bit at a time. We're going to ask that you read the information. If you have questions, let's reconnect with us. We'll help clarify a few things if you're confused. But it's going to have info on what you need to do. Either do nothing, or if you're under the Blue Cross plan and maybe you're entertaining transitioning to the Humana plan. That essentially means that your Blue Cross is going to cancel on 12/31. We're going to do that for you automatically if you enroll in the LPSS Humana plan. So if once enrollment opens up with Humana on October 3rd, okay, in that packet you're going to get the date 10/3 so you can remember when you can enroll. You're going to get a telephone number on who to connect with, and you're going to get our plan information. But I would say I'm going to give you some homework to do prior to October 3rd. I really do not allow members to go from our current Blue Cross plan onto Humana without properly having a conversation with Humana, asking those questions about your physicians, the facilities that you see, and the drugs that you are on. I don't want you to have a negative effect, because once you transition to Humana on January 1st, you have to stay under that plan for the entire year until the next open enrollment period, to which you could make a change. We provide the same offering every single year to where you could go back to the Aetna plan. But just know, then you would call in. I want you to call Humana ahead of time, check those pharmacy and medical benefits to see if they're covered under Humana. If they are, then effective 10/3, if you want to enroll, you would call that customer service number. The call number is going to be in the packet that I send to you on Friday. It's going to have all that information. And then when you enroll with Humana, we're automatically going to cancel you off the Blue Cross plan. So you don't need to come and see us. We're going to pull you up on a report and we're going to know it. Actually, remind me, we're sending them confirmation so they at least know that we know that you made that change. okay? We're gonna update your premium and your pension, okay, because it's gonna be a reduction, is what it's gonna be from your Blue Cross to the Humana plan. So we're gonna do a lot of the heavy lifting for you, then you're gonna be on the lookout for your card, you're gonna update your pharmacy and your medical providers with that new Humana information should you decide to enroll. Just know you have choices. Just know that we're going to communicate with you. Keep in mind, we're going to do text messaging. We're going to do email. It's also listed on our department website on the main LPSS page. We're going to tell you how to get there. We're going to send you postcards to remind you of all these changes that are occurring. I'm going to stop for a second. If you decide that you don't want to elect the Humana plan and you decide to instead stay with the other, we're just going to automatically transfer you there too. Okay? So be on the lookout for the communications. My recommendation would be to read them. And then if you have specific questions or perhaps it's just too much and it's way confusing, connect with our office. Please leave a message. There's Ashley's one person, there's a lot of retirees, okay? Leave a message, we'll reconnect with you, we promise. If Ashley's busy, I'll put another staff member on it, we'll make sure that we connect with members as soon as we can. But it's gonna be a busy season because the board did initiate a lot of changes. Health insurance and 2 pharmacy changes, plus we have point solution changes under the medical plan. There's a lot of moving parts this year for both active and retired members. Okay?
Everything will be effective in January.
Yes, so should you make a change, the change is effective January 1st. Okay? You'll, Blue Cross will end if you're under Blue Cross on 12/31. We'll automatically transfer you to the new Aetna plan and we're gonna send you a card. Okay? But if you decide to cancel your Blue Cross, we're gonna take care of that automatically too. We're going to cancel your Blue Cross, and then when you roll in Humana, you're going to get your card, and then you'll start effective January 1st under Humana.
I've already spoken with Ashley, but
Okay.
My birthday is December 28th, and I turned 65. I'm so blessed to be in that confusion.
Ashley, you want to offer any? We can speak to you individually, ma'am. I'm sure it sounds like Ashley's already helped you.
Yeah.
Yeah, you come on the tail end of that. She's a December Medicare eligible retiree. Yeah, she's transitioning to Medicare, and that comes with
And I want to go to
some
Humana.
complexities based on the fact that you're in the middle, and we got a lot of changes going on. But I'm sure Ashley can point you in the right direction because she is the expert. Okay.
She's done well.
Yes, very, very blessed with the staff that I have. Yes, ma'am.
This is probably an uneducated, you go to Humana,
Okay.
and for myself, the payment is the Medicare deduction. Yes.
You talking about your premium, ma'am?
I understand what you're saying.
Okay, so right now with Blue Cross, you're used to paying your Medicare deductible, your Medicare premium. Either it comes out of Social Security check or your benefit that you receive, or you get billed. And that's a fun bill, because it's a lot. It's every 3 to 4 months at a time. Okay, so with Humana, you're down to literally, if it's just you, just a retiree, you're down to 1 premium. You will still have to pay for your Medicare if you are enrolled in Humana. So you have to pay for Medicare whether you stay with Meritan or if you enroll with Humana, because you have those benefits through Humana, so you need to maintain that Medicare. Plus, we have a Medicare mandate. So yes, your logic is correct.
So it comes out automatically?
Yes, ma'am.
You don't do anything?
Right. We're going to adjust your premium and your pension per your open enrollment change. So you don't have to do anything with your pension, okay? We're going to make that change for you. And however you pay for your Medicare will stay the same as well. That's not going to change. But you are right. You're essentially going from 1 premium to 2. Or your premium for the Humana side is going to be considerably less than your, obviously, Medicare will stay the same. So yeah.
That stays the same. And then the spouse would be, from what she said, $49
Yes, ma'am.
to Humana.
Yes, ma'am. $49 for the spouse if the spouse is not a retiree of LPSS.
Right, but, and that check, that $49 goes automatic?
Yes, we'll adjust it in your pension. So we're still going to collect the premium from you because you are the retiree, and we're going to adjust that. So you're just paying for him $49, and that'll come out of your pension.
Thank you.
You're welcome. Any other questions? Yep. Hey, Ms. Claudia.
Say, okay, I am Medicare now, you're all.
Yep.
And I went to Humana,
Yes, ma'am.
and then I have my husband who is on Blue Cross,
Mhm.
and he's fixing to transfer to Humana.
For open enrollment.
Yes.
Yep.
So I didn't really know. Well, so just tell me what kind of happens after that.
So he's going to follow the same process that you did when you enrolled in Humana. So now is his opportunity, because he couldn't do it
Right.
back then. Now is his chance to jump on that train with you. So then ultimately at the end of the day, your premium will be $49 because he is not a, and that's, so now is his chance to join you. But just remember, it'll be effective January 1st. Anybody else? Yep. Okay, well, if anybody, if there's no other question, oh, yes.
Okay, y'all are on Humana. Okay, how do you feel about, does it cover about what Blue Cross is covered?
I've been very pleased with the man.
I have two.
Okay, so her question was, we have some retirees in here that are under Humana right now. So she was asking, how has your transition been to the Humana plan? So you reminded me, when I sent out that open enrollment packet, we did survey our members who transitioned from Blue Cross last year to Humana, effective January 1st of 2025. We had, don't quote me on the numbers, but take a look at the packet when you get it. There's roughly 230 members who moved from Blue Cross to Humana, or LPSS Humana. I think 68 responded to my survey. I sent it out electronically. Of those 68 members, there was only 5 that responded that they want to transfer back to the Aetna plan. So I asked them questions with regard to costs. How have your costs been? How has the services been under Humana for making physician appointments, facility appointments? How has your transition been with your pharmacy benefits? I try to keep it real general, so there wasn't any bias included in the survey. I did ask them to provide any comments that they wanted to. A lot of members have transitioned and they are happy with the services. I always say your fellow retirees are your best resource. I'm gonna mention Ms. Daphne Villamoret. She is a wonderful advocate. She's under the superintendent's advisory committee, and she is under the LPSS Humana plan, and she's been on it for numerous years. I want to say 13 plus years. And she is an advocate. She is helpful. She can help answer your questions. Both her and her husband are double LPSS employees that retired from the district. They've had surgeries and other medical services, and she can help answer any questions that you may have. But our members, I get it. It's intimidating. You're looking at a change. You've been comfortable with the plan that you've currently been under. You've been under it for quite some time. And then taking that leap of faith because you're concerned about your medical and your pharmacy services being covered. But a lot of our members last year took that leap of faith. And right now I'm only being told that 5 are wanting to transition back. So when they connect with us during open enrollment, I'm gonna ask the why. I want to improve. Maybe it didn't work for them for whatever the reason is, but the more information that we know, maybe we can go back to Humana and perhaps correct some concerns that they may have had that drove them back to the group health plan, which is now Blue Cross, but will be Aetna. So be on the lookout. Take a look at that survey. It's a one-pager within the document. I have given it to the board insurance committee, Mr. Hidalgo. I've given it to superintendent, and I'm really pleased with what the retirees said within that survey. It was positive in numbers. I want to say there was nothing below 92 or 93%. So members were happy with the services that they've had over the last year, and that was super encouraging. But while we may know a lot about the plan, your retirees, your fellow retirees are going to be your best resource. Connect with them, and if you don't have a point of contact connection, connect with us. I'm sure one of those retirees who are under that plan would be happy to have a conversation with you, and we can put you guys in touch with each other. It might help ease some of your fears if you can ask some individual questions based on your medical and your pharmacy.
Okay,
True.
what is it?
Oh, let me tell you this. We did what you said. We called about the doctors, we called about the prescriptions, and they answered all the questions. And pretty much all of his doctors and most of his prescriptions were covered.
Okay.
And his prescription prices went down
Okay.
drastically in some of them.
So she made the statement, I'm going to again emphasize it. I don't want any retiree moving from the current plan that you're on, which is Blue Cross, to Humana without calling Humana customer service first. That's a ask of me. I'd really like to mandate it if I could. But what it does is I'm going to call it homework. Get your homework together. Get your facilities, your physicians, your prescriptions. Call the number. Okay? Have those conversations with Humana customer service rep. What they're going to do is they're going to tell you, yep, that's covered under Humana, or no, it's not. That will point you in some sort of direction. If you get off the phone from them and they say 6 things that you really need medically or via pharmacy is important to you and it's not covered, well then that pretty much answers your question. That's going to compromise your quality of care. But do your homework first, okay? My suggestion would be to do your homework prior to the enrollment date on 10/3, okay? Call customer service now. That number is open.
It's 7 to 7.
Be on the lookout for my communications on Friday. It's on a 1-pager. It's under Group Health Medicare Advantage. You can't miss it. I have the Humana logo. It gives you all the details. It tells you the customer service number. It tells you the group number, the plan number, and it tells you, what else am I missing?
Is it maybe the times?
Maybe. But take a look at that 1-pager, and it's going to point you in the right direction. Then do your homework. And then should you, maybe you're still skeptical, or maybe you have a couple questions, Miss Kayla, say, hey Kayla. Kayla is our LPSS rep that's worked with our retirees for several years now, okay? If we need to put you in touch with Miss Kayla, maybe to ask some individual questions, we can do that. Connect with Ashley. Ashley will have Miss Kayla reach out to you. That way you can have some one-on-one conversations if you're still concerned with the transition. I want you to feel comfortable with this, okay? And then just know if you move over to Humana come January 1st, then you have to stay under that plan for the entire year. That's the key pieces. Then again, in the fall, we're going to have our annual open enrollment period. That will be your opportunity, should you not want to stay under that plan, to transition back. Okay? But you can't wobble back and forth between the 2 plans. You're going to be stuck like Chuck on January 1st. Okay? So that's why I want you to do your homework ahead of time, because then you're going to feel comfortable with that decision. You're going to know, I asked them about this, this, and this. Humana told me they can cover all those services. I feel comfortable, and I'm going to take the leap of faith.
Okay, the thing that probably concerned both my husband and I when we heard that they were changing insurance and there was a possibility of Humana. We have walked out of doctors, many different things, and they just say bye because we don't have to pay anything because we have Medicare and Blue Cross Blue Shield. I'm so happy I'm finishing out the year, okay? Is that a possibility with?
Or you may have some out-of-pocket costs, is what you're saying, or asking?
Because I think.
So for your medical, no, because you're covered for all your medical services.
I got a tape.
Oh, sorry, I'm just being loud.
That's okay. I got a tape. They're not going to be able to hear you. Stay on this side, because there's the thing. There you go.
So the question was, right now when she goes to the doctor, she doesn't have to pay a copay or a co-insurance, okay? For the Humana plan, that will remain the same. So all of your medical services, we went through that slide and it lists primary care, specialist, outpatient hospital, inpatient hospital, all of that is covered at 100% on the plan. The only co-pays you're going to encounter is on the pharmacy side. But for all your medical services, you are 100% covered.
So it's the same outcome.
Yeah.
It's the same outcome.
Oh, yeah, okay, is Humana and LPSS, Humana the same thing?
No.
No.
What's the difference?
Answer that.
Okay, so Humana has a lot of different avenues, okay?
Oh, okay.
So for us, we are a group, a Medicare Advantage, we are a group plan through an employer, okay? A lot of the headaches and things that you hear about those plans, they're specifically talking about individual plans that are sold out in the marketplace. Those, but you see, it's all Humana, so everybody lumps them into one, and it's completely not the same.
Okay.
Yep. So I've actually had brokers, and I actually welcome this. I've had people take our booklet to brokers to try to look at what the broker can, or somebody that sells Medicare Advantage plans or supplements, and they can compare with what we offer to what they can. And every single one has come back and said, the brokers told me to stay with what you guys have. They cannot sell a plan that way because you can't find our plan. So it's very specific to us.
Okay, because I asked, many years ago, I asked about changing to the senior citizen or senior, whatever, the city, and she said, stay with Lafeyette Parish.
Mm-hmm. A lot of them do that.
And so that's still
Yes,
probably our
that
best.
happens. I hear that very often. That's a lot. Mm-hmm.
Okay.
Yeah, I hear that a lot.
What would cause any of this to change within a year, like next year?
Oh, that's a church question.
Okay, superintendent is already signed off on that Humana contract for 2026, so it's locked in. That I can assure you of.
But I'm talking about 2027.
2027, we assess contracts every single year to include the Meritain Aetna contract, to include the Blue Cross contract. Every contract goes before the superintendent on an annual basis. That's where pricing could change if we're not locked into a guaranteed rate or a guaranteed contract. A large majority of the contracts are on an annual basis. So they do get assessed July, August, September time periods, depending on the contract. It's reviewed based on the consultant, it's reviewed with executive staff and the superintendent, and then based on recommendations and superintendent direction, then he signs off on those contracts. So 2026 is locked in, okay? Those benefits are not changing. Could those benefits perhaps be enhanced at a later date? Maybe they add some value-added services like dental or vision or anything that you may see in those other Medicare Advantage plans, perhaps. But for right now, the services have remained the same over the last couple years. We have been having a lot of retirees giving this plan consideration. Actually, correct me if I'm wrong, but on average, 8 to 9 members a month have been transitioning over on a regular basis, and I fully expect open enrollment to have a lot more than that. We had 236 last open enrollment. However, we did have some premium increases under the Blue Cross plan, which could have drove some of that. But I do like the fact that those members that did transition over, it doesn't sound like they're going to be moving. So for right now, my answer is it's locked in for 2026, and then we'll reassess on a regular basis. Here's another key piece with that new contract. The pricing for the premium is increasing for the district only. Keep in mind, the district is subsidizing this premium, just like they subsidize your Blue Cross, which will be Aetna from January 1st. They pay a large portion. So retiree only is a 0 premium, but a cost to the district is over $250.10 is the cost to the district that they're subsidizing on your behalf. If I pulled up the full rate chart on the Meritain Aetna, which is currently Blue Cross, that we charge for the premiums, there's a retiree portion, a general fund portion, which is LPSS, there's a sales tax, which is paid by the sales tax, and there's a retiree trust. All 4 of those make up the premium. So the district is subsidizing under both Blue Cross currently and under the Humana plan too. So, but you're getting some value-added services under the Humana plan that you're not currently receiving under the Blue Cross. Does that help?
Tricia,
Yes,
too,
ma'am.
I want to tell you, premium-wise, we saved a lot of money, because we were on the high deductible for my husband and I. When we split, I'm on Blue Cross Blue Shield because of my age, and he went to Humana. We went from probably about $200 a month to $65 a month. So that's a nice extra on your
The
retirement
split
check.
contracts have been, I know it can be confusing because it's a new benefit, but my husband's older than me too. And when I become a retiree of the district, he's gonna hit Medicare before I do. I'm gonna still wanna stay under my high plan, right? At the lower premium, perhaps under the standard plan. While all the while, if he transitions to the Humana plan, it's a reduced cost for us. So if you split and give that a consideration, I had another retiree here earlier in the earlier session that said, my medical is not as bad as my wife's. I think I'm going to transition to the Humana plan. She's going to stay under the Blue Cross, which will transition to the Aetna. And they're going to receive a cost savings as a result of it. So I would say give it some consideration. It might not be right for one of the members, but it might be right for the other member. So I gave some recommendations that when he called to the customer service line, let's check both his medical and pharmacy to include the spouse's medical and pharmacy. Who knows? Maybe Humana covers all the same services that the spouse is receiving under the current Blue Cross plan. Okay? Yes, ma'am.
I was just gonna say, I went on Medicare middle of January, and you helped my husband probably like 7 years ago, and it went so smooth. So my husband starts getting nervous again because I'm going on, do I know what I'm doing? Anyway, Ashley helped, and Ashley Wright is a sunshine name we say when we want to find out something.
Yes.
And so it went very smooth. And then and I didn't do drop. I did 27 years teaching school. And anyway, my check, and I have your email, which I've kept, and I understood everything, and I figured out how much my check would go up once I changed over to Humana. Now, at that point, I was paying my 4 payments of Medicare, which we weren't crazy about. But then I flipped over, and I'm hoping everybody knows about the Fairness Act and how you can collect spousal Social Security off your spouse. So then and if you don't know, come ask me after this, I'll explain to you. So now I overpaid my Medicare, so now I'm getting it back, we're getting all even, but I understand everything, and if I can understand it, I know anybody in here can. And then, because I did talk to one person who she hadn't even heard about it, she's older than me, but, and the other thing was Daphne. Someone told me to go on the Lafeyette Teachers Retirement Group, and you can ask Daphne about the Fairness Act, you can ask Daphne about, and that's Daphne Villameret, I'm not saying it right, but anyway, she can answer anything about Humana, because she's been on it for so long. And I've heard this over and over, that's why I can talk about it now. I have to hear it enough to be able to talk about it. I'm very pleased. And then my husband's coming on. And that was the other thing I was going to say. It was so funny. I begged my husband to come to the meeting on January 15th, and he didn't want to come. And all of a sudden he comes in, and we sit there, and he asks Ashley some questions. And all of a sudden he looks at me, and actually he said, you know what? Open enrollment, I'm coming. So he's coming on. Finally, and my retirement check's probably going to go up about $150. Now we're going to pay that $49. So what do I say, that's my story.
Yeah.
And I've been real happy.
I know when I was trying to explain it to him, I was like, you know, she's in January, it's right around the corner, you know, so, but yeah.
So anyway.
But
What y'all missed on that explanation for the video is Miss Ashley was getting some kudos, and our retiree who transitioned to Humana has been very pleased with that transition. So I encourage you, we have an amazing staff who can help answer those questions for you. We can help point you in the right direction. I just ask that you give a little bit of grace. The open enrollment season is going to start. There's a lot of retirees. Please leave a message if you're not able to connect with us. Please, I encourage you, read the materials that come to you first. Oftentimes, your question is likely answered in those materials. Keep in mind, we're going to segment them, okay, so that you have ongoing communications. That was the superintendent calling a moment ago. I had to text them back. But keep in mind, we're going to send those ongoing communications, and we're going to make sure that we keep you informed, okay? That's the key piece. But if you need something, please connect with our office. We appreciate all your wonderful questions today. If you've got any questions, be on the lookout for those Friday communications based on open enrollment opening. And if you need something, just reach out. Thank you so much.
Thank you.